Welcome to Get Word 101. In today's live broadcast, we're going to be talking about something that is spreading, that has become so common among young adults. So, we will be looking about the possible causes of stroke. What are stroke? What are some of the health prevention tips? What are some of the causes? What are the signs and symptoms of stroke? What are the early warning signs of stroke that people often ignore? Okay, so we'll be looking into all that. We'll be looking into all that. So in Gateway 101, we remember we do not diagnose, but we give you some healthcare prevention tips. Okay, we'll give you some healthcare prevention tips, and also we'll create healthcare awareness. That's what we'll do with this channel. It teaches you a simple home remedy to help alleviate symptoms, prevention tips, and healthcare awareness. We create major healthcare awareness. This would help you from going to the doctor every minute. This will save you money, to save you time, because we strongly believe that prevention is better than cure. Whatever we are saying in Gateway 101 does not constitute medical diagnosis in any way. Okay? It is simply a healthcare awareness. We do not diagnose or prescribe. We we only encourage you to go to a medical provider so that you get treated, because early treatment will prevent complication, and late treatment will give you complications. So do not forget, and do not forget to subscribe. Please do not forget to subscribe, because it takes a lot of work to bring out this research. Okay, it takes a lot of work to bring out this information. So do not forget to subscribe. So without wasting much time, let us dive into today's topic. So we are talking about stroke. Please do not forget to subscribe, very important. We're talking about stroke, and we say that a stroke is a medical emergency. Excuse me. It happens when blood flow to the part of the brain is blocked, or when a blood vessel in the brain bursts, causing brain cells to start dying within minutes. It is a medical emergency. Stroke, it is a medical emergency, because a stroke is a medical emergency because it happens when the blood flow to part of the brain is blocked. So the brain no longer receives oxygenated blood, or when a blood vessel in the brain bursts, causing brain cells to start dying within minutes. Okay? And common sign and symptom of stroke, using what we call the FACS rule. Use the FACS rule to remember the most important warning sign of a stroke. Face, it means your face will be drawing, dropping, face dropping. One side of the face drop or feel numb. Smile, look uneven. When you smile, look uneven. Those are some of the early warning signs of stroke. Then your arm will become weak, suddenly weakness or numbness in one arm or leg. You can hardly raise both arms evenly. These are some of the early warning signs of stroke. Okay? Trouble speaking. You have a slurred speech. You have trouble speaking, or understanding a simple sentence. Your speech is complement. Okay? Your sentence is not equal, it's not even. Okay? So your speech become sluggish. You have trouble making a simple sentence. Okay, so T stands for time. It is time to call emergency service. Call 911 or call your local emergency number immediately if you're having any of these warning signs that I have just mentioned. Okay, stroke is no joke. Other stroke symptoms, this can appear suddenly. Please do not forget to subscribe, very important. Numbness or weakness on one side of the body, sudden confusion or memory trouble, trouble seeing in one or both eyes. These are some of the early warning signs or symptoms of strokes. To pay attention. Remember what we said in this program, that before you develop a major illness, your body must have given you sign time without number, but you just choose to ignore it. Okay, so this is Gateway 101. Do not forget to pay attention to your body. Why this does not constitute medical diagnosis, this is healthcare awareness. So subscribe so that you get more healthcare tips. Okay, so we are talking about other symptoms of stroke. Sometimes you have trouble seeing in one eye or both eyes. Sometimes you feel that the eye is closed, but your eye is not closed. You can find it difficult to close your eye. These are some of the early warning signs. So sudden dizziness, loss of balance, or trouble walking. These are some of the severe warning signs of stroke. Severe headache with no known cause. These are some of the warning signs of stroke. So pay attention to your body. I keep saying this, that before you develop a major sickness, your body must have given you a warning sign. Okay? So pay attention to your body. If you are having any of these symptoms I'm mentioning, it is time for you to seek medical help. For a medical emergency, when stroke hit, every second matters. So you have trouble swallowing. If you find it difficult to swallow, these are some of the early warning signs of stroke. Okay? And if you're having trouble chewing, these are some of the early warning signs without known cause. Loss of consciousness in severe case. When stroke hit, you become unconscious because the vein carrying oxygenated blood to the brain, guess what? Busted. So you lose consciousness and it can be fatal. Okay? Okay, so signs specific to certain stroke type. Ischemic stroke, blocked vessels. The vessel that carry oxygenated blood to the brain block. You have weakness or numbness. Speech or vision problem. You develop speech or visual problem. Okay? Then hemogenic stroke is bleeding in the brain. Hemorrhagic stroke is sudden and it is severe. You have what we call worst ever headache. It has some of the warning signs. Okay? So these are some of the early warning signs. So if hemorrhagic stroke hit, you have a bleeding in the brain. It is sudden and it is severe, and you have worst headache ever. You may develop nausea, vomiting. You become sensitive to light, and you also rapid loss of consciousness. It is an medical emergency, and it can be fatal if it is not properly handled. Okay? And important to know, stroke symptoms may be painless. They can be temporary, such as TIA, mini stroke. It is still an emergency. Early treatment saves brain cell and life. Do not forget, in stroke, the vessels carry blood to the cell burst. So early treatment will save the brain cell and life. It can be fatal. Okay, so let's look at some of the causes of stroke and signs and symptoms of stroke. Let's look at some of the signs and symptoms of stroke. Like I said, causes of stroke, I mean to say, let's look about some of the causes of stroke. Major risk factor for stroke. Major risk factor for stroke. Let's actually go through this again. A stroke happens when blood flow to part of the brain is cut off, or when a blood vessel in the brain bursts. Here is a clear, no-nonsense breakdown of causes and risk factors. The main causes of stroke, such as ischemic stroke, is the most common stroke, about 85% of strokes. It is caused by a blocked blood vessel supplying oxygenated blood to the brain. So blood clot from the heart or neck artery can also cause this type of stroke. Atherosclerosis, fatty plaques build up in the artery, can also cause this type of stroke. Narrow carotid artery in the neck can also cause this type of stroke. Hemorrhagic stroke, it is caused by bleeding in or around the brain. High blood pressure is the most common cause of this hemorrhagic stroke. High blood pressure is the most common cause of it. Rupture aneurysm, arteriovenous malformation, AVP, head injury, or blood thinning medication can also cause this type of stroke, hemorrhagic stroke. Transient ischemic attack, also known as TIA, is a mini stroke, but it's also a medical emergency. It is temporary blockage that resolved on its own, but it is a major warning sign of a future stroke. So if you have TIA, please know that you are at a major risk of developing stroke in the near future. So pay attention, get treatment immediately. Major risk factor will be controllable risk factor. These are the big ones you can add on, such as your high blood pressure. Remember that we said that high blood pressure is the number one risk factor for stroke. So, but it is controllable. Diabetics, high cholesterol, when fatty plaques build up in the artery, therefore causing the artery to become stiff and hardening, causing CAD, coronary artery disease. This can subsequently lead to stroke. Smoking narrowed your arteries. Okay, so these are some of the major risk factors that contribute to stroke. Obesity and physical inactivity. You are not doing physical exercise at all. Okay, if you are not doing physical exercise at all and you're obese, don't forget that obesity puts pressure on your body organs. Okay, so these are some of the major risk factors for stroke. Unhealthy diet, high salt, sugary food, processed food. These are major risk factors for stroke. Heavy alcohol use. Alcohol actually still narrow your blood vessels, made them stiff with time. So it's a major risk factor for stroke, but they are controllable. Drug use, illegal drug use such as methamphetamine, cocaine, crack, illegal drug use, they are major risk factor for stroke, but they are controllable risk factors. Okay, you can simply avoid them and you are fine. Heart conditions such as atrial fibrillation, heart failure, these are major risk factors for stroke. Non-controllable risk factors. Please do not forget to subscribe and share. Do not forget to subscribe and share. Non-controllable risk factor for stroke. You cannot change this, but they matters, such as age. Age is a contributing factor. Risk rise after 55 years. Family history of stroke, it can be genetic and also heredity. So that you cannot change. So, sex, male have higher risks, women have higher mortality. Why men have higher risk of stroke, women have higher mortality rate of stroke. Okay, so previous stroke or TIA, you cannot, TIA is a warning sign that stroke is near in the future. Okay, so pay attention if you have transient ischemic stroke, also known as TIA. Race, ethnicity, higher risk in blacks, Hispanic, and South Asia population. Please do not forget to subscribe. This is Gateway 101. So, less known risk factor, sleep apnea, chronic arteries. These are contributing factor to stroke. Pregnancy and birth control pills, especially with smoking, is a major contributing factors. They are less risks, but they can also contribute to stroke. Inflammatory conditions such as lupus, COVID-19 increase clot risk in some people. Yeah. Stroke prevention starts with you. And I repeat again, stroke prevention starts with you. Controlling your blood pressure, which is the number one major risk factor, number one contributing factor to stroke, by high blood pressure, is controllable. That's why I'm saying that stroke prevention starts with you. You can control your high blood pressure by change of lifestyle, taking medication, doing diet and exercise. This can help you control your blood pressure. So that is controllable. Quitting smoking depends on you again. So that's why I said stroke prevention starts with you. You can quit smoking. Smoke contributes a lot because smoke narrows your arteries and make them stiff and hardened, therefore causing blood blood blockage. Okay, managing blood sugar and cholesterol. Yes, you can manage your blood sugar. You can also manage your cholesterol level. Cholesterol and these are fatty plaques that build up in the artery and subsequently result to blockage. And when that happens, stroke hit. Exercise 30 minutes most day is of great benefit. Eating a heart-healthy diet, so it's also of great benefit. Regular medical checkup, we cannot overemphasize that. Regular medical checkup is very, very important. Okay, and that's why in Gateway 101 in our community here, we volunteer taking people to their medical checkup for free. If you don't have a way of getting to your doctor for your routine medical checkup, we do provide transport for you free of charge. You just have to let us know on time so that we make arrangement to take you to your doctor appointment, because we believe strongly that prevention is better than cure. If it is caught earlier, it prevents complication during treatment. Okay, so we do encourage that. Okay, let's talk about some of the stroke prevention tips. How to prevent stroke naturally and medically. How to prevent stroke naturally will be natural lifestyle prevention. Here, we're talking about these are foundations, powerful and proven, such as controlling your blood pressure is most important. Do not forget that number one cause of stroke is high blood pressure. So controlling your high blood pressure is most important. Limit your salt or avoid processed food. Eat potassium-rich foods such as banana, beans, spinach. Then exercise at least 30 minutes, 5 times a week. Okay? Manage stress. Take a deep breath all the time. Prayer, meditation, and stretch. Walk around. Do not overwork yourself. High blood pressure causes 50% of stroke. Eat a stroke protective diet. Focus on vegetable and fruit. 5 to 7 servings per day. Fatty fish such as salmon, sardines, they are full, they are loaded with omega-3, which is good for your heart. Whole grain nuts and beans, olive oil instead of butter. These are some of the healthy heart diet. Okay, so avoid fried food and also avoid sugary drink. Avoid red and processed meat. The Mediterranean or DASH diet reduces stroke risk by up to 30%. Exercise regularly. Brisk walking, cycling, swimming. Aim for 150 minutes per week. Even light daily movement helps a lot. Maintain a healthy weight. Belly fat increasing stroke risk. And I repeat again, because that puts pressure on your body organ. So a belly fat increases stroke risk. So if you're having a pot belly, a big fat belly, you are at a risk for stroke, because belly fat puts pressure on your body organ. So you are at risk for stroke. Losing 5 to 10% of body weight helps BP, sugar, and cholesterol level. Control your blood sugar, especially important if diabetics or pre-diabetics. Control your blood sugar and reduce refined carbs and sugary snacks. Pair carb with protein fiber. Okay, quit smoking and limit alcohol intake. Okay, quit smoking and limit alcohol smoking because smoking doubles stroke risk. Do not forget that smoking narrows the arteries. Alcohol, maximum of 1 drink per day for women, 2 for men. Sleep well, at least get 7 to 9 hours of sleep. Treat sleep apnea if present. It's a big hidden risk for stroke. Medication prevention, doctor's guide. These are crucial if you have risk factors such as high blood pressure medication. Take exactly as prescribed. Don't stop taking high blood pressure medication suddenly, even if your BP feels fine, even if your BP is normal. Please do not forget to subscribe. Okay, please do not forget to subscribe. God bless you. Cholesterol lowering drug, Cystatin. This reducing plaque buildup, especially important if diabetes plus stroke. You have stroke before, have TIA before. So make sure you take your prescribed medication, cholesterol lowering medication. It helps reduce the plaques buildup in your artery. Okay, especially if you are diabetes or you have stroke before, TIA, you have a heart disease. Make sure you take your cholesterol lowering medication. Blood thinner if needed. Example, aspirin low dose, Plavix, and Coumadin for atrial fibrillation. But these are prescribed medication. You can't take them over the counter. Only take this if prescribed. Self-use can be dangerous. Okay? Do not forget to subscribe. Do not so that you get more of my videos. Do not forget to subscribe. And treat underlying condition. Atrial fibrillation, irregular heartbeat should be treated. Diabetes should be put under control. Heart disease should be treated. Okay? So know the warning sign. If prevention fail, act fast. Face dropping, arm weakness, sluggish speech, it is time for you to call 911 immediately. Please do not forget to subscribe. Prevention strategies. Combine lifestyle plus medical care. Even on medication, lifestyle changes are more negotiable and also very important. Okay? So these are some of the prevention tips to help prevent stroke. Okay, do not forget to subscribe because in Gateway 101 we do not diagnose or prescribe treatment. We only create healthcare awareness. That's what we do. We create healthcare awareness. Okay, so do not forget your regular checkup. Very important. Make sure you do your routine medical checkup. Okay, because if before you have any major illness, your body must have given you one sign multiple times, but you just tend to ignore. Otina, come your way again. This is Gateway 101. Do not forget that if you're living in a Metro Atlanta area and you are finding it difficult to get to your doctor, we make a free arrangement for you to get a ride to go to your medical checkup. If you want to go and see your doctor, you don't have a ride, contact us. We would help you with one. But you have to make an appointment early. It is free of charge. You don't have to pay anything. We just get you to your doctors and take you back home. Okay? If you live in Metropolitan Atlanta area, especially I-20 East down, we'll provide free transport for you. So do not forget to subscribe as we do everything possible to help our community, to create healthcare awareness to our community. Okay, so we always come on air to share healthcare tips. We come on air to give you some prevention tips. We come on air to give you a simple home remedy that will help alleviate symptoms. And we continue to preach that before your body develop a major illness, you must have multiple warning signs that you tend to ignore. Until I come your way again, this is Gateway 101. Thank you for watching. Stay blessed. Bye for now.